I have been a nurse for 35 years. Most of that time had been as a flight nurse. I flew on a helicopter as a flight nurse for about 20 years. I'm currently a vice president and administrator of a small 25-bed hospital. We are a part of a larger health system that is headquartered in Roanoke, Virginia. Most of our hospitals are based just below the beautiful Blue Ridge Mountains in Virginia, and we have a lot of farmland, which is why most of us consider our hospitals and our place of work as a rural setting or rural hospitals. The administrator before me actually called our hospital a suburban hospital, meaning both rural and suburban, but he always said that we just forgot to tell the cows. So that's how we kind of view ourselves in a rural setting. I'm hearing impaired, and that is part of the story that I hope to be able to share today. So I was born deaf. I currently wear 2 hearing aids, and I depend heavily on lip reading. I wanted to go into the military, but at the time I knew that I could not pass the physical for any military involvement. However, I set my sights on the next best thing, and for me that was nursing and helicopters. And so I joined a EMS crew, took my EMT course, signed up for nursing school, graduated from a small college, an associate degree program at a community college, and became employed in a level 1 trauma center at Carilion Memorial. And what's really interesting about that is my first day on the job, everybody followed me around so that I could see their face. And it was really an important step for me, because that told me that they were very interested in making sure that I survived and became a nurse in their hospital. They were very willing to help me out that way. The story that I like to tell a lot, though, is when I applied to be a flight nurse, there was a lot of concern about me being a flight nurse and wearing hearing aids. And so I was able to convince the flight crew leadership to take me up on a flight and ask me questions. And they could wear their headsets and their helmets, and I wouldn't wear any. So I did not wear a headset. I did not wear a helmet. I did the entire hour-long interview in the helicopter on a flight simply by lip reading. And that was enough to convince them to allow me to interview in an 8-hour interview process for the job. And I got the job. And so that was the highlight of my career, if you will. In 2000, I became the clinical team leader of the flight crew and continued flying. And I think it's really important to just simply understand that with a rural setting and the caring people in those settings is what really has helped me advance my career. COVID has certainly been a challenge for me. And as you can imagine, we're wearing our masks, we're wearing our goggles, we are wearing our shields, and the lip reading part has been quite a challenge. People in my system know me, they're well aware of my needs, and I had people coming out of the woodwork to make sure that I could get a mask with a clear shield so that I could hand those out at every meeting that we were going to, and I could continue to read their lips even though they had a mask on. I had people calling me all the time looking for ways to help me, and I'm not sure that I could have received that kind of help in a non-rural environment. So I'm blessed, and I'm very appreciative of the work that I do and the place that I work at. And the rural environment has certainly helped me with my nursing career.